In this video, the Varus stress test will be demonstrated to test for lateral elbow strain or instability. Let's begin by defining what the Varus stress test actually is. This test can be used by examiners to test for lateral elbow strain or instability that could be indicative of trauma or injury. The patient may be sitting or standing upright with their arm in a supine position. The glenohumeral joint should be in a neutral position. The examiner should be standing medial to the joint that is being tested. The test will begin once the examiner places their hands in the appropriate position. Specific hand placement of the examiner should proceed as follows. First, the patient's arm is supine. The examiner then grabs the patient's elbow with their fingers on the lateral elbow joint. The examiner's opposite arm will hold the patient's distal forearm. Lastly, the patient's arm is positioned at a 25-degree angle. The examiner will then apply a Varus force adducting the patient's forearm. The patient should relax as they allow the examiner to guide their arm through the test, telling the examiner if they feel any pain. Here is the Varus test performed in real time. The test should be performed at varying degrees of flexion. A positive Varus test is indicated by pain or an increase in laxity of the joint. The patient may exhibit one or both of these signs and symptoms. The pathology concerning the Varus stress test is as follows. Increased laxity can be a result of an epiphyseal or bony injury. An increase in laxity can also result from a decrease in cartilage of the joint. This could also lead to rheumatoid arthritis. It is also important for the examiner to note the degree of laxity. A moderate degree of laxity is indicative of radial-collateral ligament trauma. A gross degree of laxity indicates annular or lateral ulnar collateral ligament damage. While there is currently no comparable Varus stress testing in the literature, it is important to note that the patient may be in a sitting or standing position for examination. Unfortunately, there is currently no literature surrounding the sensitivity or specificity for the Varus stress test. That concludes the Varus stress test. Thanks for watching.